Israel's blockade on medical supplies is rapidly increasing the threat of diseases in Gaza. The notorious Gaza Humanitarian Foundation is providing limited amounts of food, but does not give out medicine, shelter, or water. The World Health Organization says destroyed health facilities and access to clean water has increased the risk of meningitis spreading. Tareq Azzoum reports from Deir el-Balah on how many of those born during the war are feeling the brunt of this outbreak.
In overcrowded shelters in Gaza, where hundreds of displaced families share limited space with little access to clean water or sanitation, cases of meningitis are rising, and children are particularly at risk. The disease causes inflammation of the protective membranes that surround the brain and spinal cord. Without treatment, it can lead to brain damage, hearing loss, or death.
This is one of the critical disease. We have lack of treatment for it. We have shortage of antibiotics like vancomycin and acyclovir. We have shortage in cultures for the CSF and rapid tests to know what the kind of viral and the source of that viral.
Israel's war has destroyed Gaza's health system. Vaccination campaigns have stopped. Medical supplies are running out. The Gaza Humanitarian Foundation is failing to deliver enough food, and forced displacement into shelters and tent camps creates ideal conditions for the spread of disease.
There is normally, you see a spike in meningitis in this time, so it's June to August, etc. And although we are, of course, very concerned and we have to monitor this very closely, there seems to be more cases. And is this because of crowding and everything else related to that? The overcrowding in shelters in the camp, the absence of basic hygiene, the disruption of routine vaccination, inadequate access to healthcare, etc.
And for diseases like meningitis, early intervention can mean the difference between life and death.
It was around midnight when her fever spiked dangerously high and she began having convulsions. I took her to the hospital immediately. The doctors examined her and performed a lumbar puncture. Later we were told she had meningitis. She's now receiving treatment, but her condition is complicated by severe malnutrition.
As negotiating teams focus on a ceasefire and the release of captives, the children of Gaza are facing a death sentence, one that comes quietly, painfully, and without warning. In a war that has already taken so much, the outbreak of meningitis is a grim reminder that the price of the conflict is paid not only by the fallen, but by those who left in makeshift shelters, suffering in silence. Tareq Azzoum, Al Jazeera, Deir el-Balah, Palestine.
We'll now speak to Dr. Khamis Elessi, who's a neurorehabilitation and pain medicine consultant. Dr. Elessi, you've been volunteering at hospitals in Gaza City since Israel's war on Gaza began nearly 2 years ago, and you're joining us this morning from al-Ahli Hospital, that's in Gaza City. Thanks for speaking to us. So you have been treating cases of meningitis. How fast is this spreading, and what have you been seeing?
Well, so far, there has been more than 500 cases recorded in the Gaza Strip and documented. And fortunately, the vast majority of them are viral in nature, which means most of these cases will end up resolving quickly and without a major complication. But we are speaking about more than 40 cases who are bacterial in nature, and those cases usually end up with crippling disability, ranging from loss of hearing, loss of speech, or paralysis of certain parts of the body, or total paralysis, because as you know, meningitis affects all covering around the brain and the spinal cord. And not only that, this situation is a crippling disease, not for the patient, but for the family as well, and for the caregiver. Imagine somebody with a child who's unable to move, unable to serve himself, and the family is moving from one place to another. Now, who are they going to care for? Their disabled child or the rest of the family? And in light of what's happening in Gaza with lack of food, lack of water, lack of sanitation, and overcrowded situation in Gaza, situation is the perfect environment for the spread of disease. We are speaking about 2.2 million individuals not living in the tiny area of 365 square kilometers, which was labeled by international organizations as the most densely populated worldwide, with a density of 5,700 individuals per square kilometers. Now those 2.2 million are stranded in less than 40 square kilometers. So you're speaking about 50,000 individuals in single square kilometer. And this is the perfect environment with lack of water, lack of sanitation, lack of hygiene, and lack of food, and lack of fresh air. This is the major component for spread of disease. And
Right.
if disease progress to pandemic, God forbid, there will be a catastrophe all over Gaza.
So how difficult then is it for you to actually treat cases of meningitis with the blockade going on and stocks of whatever you may need severely limited?
Okay, as you know, the major treatment of meningitis is antibiotics, and this antibiotics should be given intravenously and should be given in a hospital. But unfortunately, what remains working among hospitals is less than 7 hospitals out of 36 hospitals. And these 7 hospitals are working partially, and they are overcrowded. The capacity of these hospitals has been multiplied. Instead of taking 100 patients, each hospital is taking 3 times its numbers. So those patients need to be put in isolation, but unfortunately there are no place for isolation. Those patients need to be hooked to ventilators, and those ventilators are needed for the patients who are hit in their heads or their respiratory system or need ventilation. And they need continuous antibiotics, strong antibiotics. But unfortunately, these antibiotics are not available. And the doctors in the hospitals have to favor certain patients on others based on the probability of them survive. Unfortunately, those patients with bacterial meningitis will end up with crippling disability. And since most people affected are the youngsters and are the malnourished, so those patients will die eventually or will live with permanent disability. But the solution for this is to open up borders and provide proper food, nutritious food, proper clean water, proper hygiene, stop the war and let people go to the remnants of their homes. So at least there is no overcrowding, because this is the major factor.
So with the Israeli
disease.
forced displacement orders that are going on, and the Israelis trying to basically forcibly transfer people from the central and northern parts of Gaza down to the south of Gaza, how much worse do you think this may get?
No one can imagine actually the catastrophe that is going to happen if the remaining people in Gaza and middle zone of Gaza are pushed towards the south, and with this 2.2 million are being squeezed into a tiny area less than 20 square kilometers, and with this prevalence of meningitis and other fecal-oral diseases with poor hygiene, no water, no sewage system. Unfortunately, the sewage system is not working completely here in Gaza, and major parts of the aquifer is mixing with the sewage water, which has led to upsurge of fecal-oral diseases. And with poor sanitation, this will be a perfect recipe for emergence of pandemics all over Gaza Strip. And this really is so worrying, not only for Palestinian doctors, but for the rest of international organizations that is working with humanitarian or medical sectors, because those children, if their brain is affected, God forgive, they will end up paralyzed or crippled forever with certain special needs and special disabilities. And the burden will be on top of their families and on the healthcare system that is already crippled by malfunctioning hospitals and lack of essential medicines, lack of medical supplies. Can you imagine, besides those patients who are suffering from meningitis, we have to care for 350,000 patients with chronic diseases like hypertension, diabetes, heart disease, respiratory disease, and 3,000 patients with kidney failure. Now, among those 3,000 kidney failure, we only have 1,000 left. It means more than 1,500 have already died,
Right.
because they are not receiving proper dialysis. And amongst 11,000 patients with cancer, less than 7,000 or 8,000 are existing now with no chemotherapy, radiotherapy, or any analgesics or palliative care or pain medications.
Okay, Dr. Khamis Elessi, thank you so much for speaking to us this hour from Gaza City and giving us your perspective. Thank you.
Thank you for having me.
Make sure to subscribe to our channel to get the latest news from Al Jazeera.